This is a 52-year-old patient who has presented with headache, and this is the MRI that's showing those big flow voids with some surrounding vasogenic edema. This is on the T2. You see these markedly dilated vessels of a deeply located arteriovenous malformation. So this edema is also showing signs of previous hemorrhage, or just is an indication of potential rupture. So the patient was brought to us for treatment. This is the angiogram which we did, and you can see this is injection from the internal carotid. Posterior communicating is markedly dilated. Posterior cerebral supply. You see those big vessels that are going into this big nidus and markedly dilated vessels. Deep drainage that goes into vein of Galen and straight sinus. There's some also backflow in the venous, hypertension that goes into the superior sagittal sinus posteriorly. So we decided to go in with a balloon microcatheter, put the balloon distally in the branch, and try to control the embolization as good as you can to be able to penetrate this nidus nicely. So this is as we progressed in the embolization. We continued injecting from this location, and sometimes what I do is as we get better and better penetration, since there is a branch proximal, we let it reflux back and then fill those other branches. So this was a quite nice embolization, and everything was progressing quite nicely with good control of the nidus, very little filling of the vein. As we progressed even more, this is now very nice results. It looks like most of it is gone, but there's some pooling in the vein. And then we started seeing some embolic material proximal to wherever this is, and this proximal embolic material is basically getting into the posterior cerebral artery and also taking some of this branch over here. We did several injections to see whether this is gonna cause more and more closure of the vessel. Unfortunately, it looked like this vessel was going to close. So what we did a thrombectomy. We placed a stent retrieval into this location, tried to capture this is the embolic material that has escaped from the normal position. We opened the stent and we started pulling it down. So as we are, you can see that we are pulling this embolic material down little by little, and it pulled itself out of this vessel. This is the other video showing how we are pulling down this embolic material, and it comes back and being captured by this stent retrieval as we put it into the guiding catheter, and we got it out all the way. And in the final results, we got this vessel open completely. We got the AVM completely cured, and there was no residual AVM, nor was there any big infarction. We did the follow-up, and the follow-up showed no infarction. The patient also had no deficit.